Good morning, everybody. So last class we were talking about what is behavior and what are the classifications of behavior, what is crying and all those things. So today we are going to deal with the factors that affects child's behavior in a dental clinic. So it is there are some factors which is under the control of dentist, some factors that is under the control of parents. Okay, so first we will be talking about what are the factors that is under the control of dentist that affects the child's behavior. First is the dental office, okay, how the dental office looks, dentist attire, dentist attitude, presence or absence of the parent in the operatory, and the presence of older siblings. So first is effective dentist activity and attitude. So according to Jens, he has made 6 criteria or 6 categories of activity that a dentist should do before he starts treating a child. First is the data gathering and observation. So the receptionist of the clinic has to call the patient. They should find out what is his nickname, what is his what is his favorite cartoons, what are his favorite food. All those things you need to gather the data and you need to observe it. Next is the structuring. Structuring is, you can see in the picture, structuring is an objective is to explain the child the importance of the dental treatment and its purpose in a manner that child understands. You can say that there are a lot of worms in the tooth. So here you can see a mirror is given in front of the child and child is seeing it, and child is, you are making the child understand in the child's own words that your oral health is poor, we need to improve it, or we need to do some procedures so that it can be improved. So that is called as structuring. So you need to structure the child. So these are the different ways of structuring. Where toothbrushing means when you brush the teeth, the worms will be jumped out of it. Or washing the mouth with vacuum, and the 3-way syringe means it's like a vacuum where the germs get scared and they'll just jump out. Cleaning of the tooth. You can see there are different types of pictures. It's been put up on the screen. So these are the different ways of structuring, or you can say that euphemisms we'll say. Now next is the externalization. Externalization means attention, perception, sensation are on the site of injection. So the eyes closed, mouth open, body rigid, and draw the attention to the other stimuli. So in such cases, you can you can use externalization. Externalization means you're doing a procedure and you're telling the child to do some other activity. Like say for example, you count 1 to 5, or you just raise your leg. So his mind will get externalized on that. So he won't be feeling what the dentist is doing. Next is the distraction. Distraction is attention is focused away. And next is the involvement. Involve child so that child's verbal or motor discharges do not interfere with the treatment. So you try to involve with the child when you are doing a procedure. You can see a dentist showing a model and the child is seeing it. So child's involvement and the dentist involvement and the parent involvement is there when they do the procedure. So next is the dentist attitude. So first the dentist should have an empathy and support. That is, it's a capacity to understand and experience the feelings of another without losing one's objective. So imagine the child is keeping on crying and your objective is to do the procedure. So you need to, your objective is there. So you need to understand the child's behavior, why he is crying, without losing the objective. So you cannot say that, okay, fine, today since you're crying, we are not going to do the procedure, go and come back next time. No, that is not at empathy or support. So for example, permit the child to express their feeling, comforting the child when it is appropriate by touching and reassuring the patient, providing him, providing a structuring situation which child can feel he is secure. Okay, so such things the dentist can do. Next is the flexible authority. So dentist is the ultimate authority when the child is taking treatment under you. That your or the dentist, dentist is the one who who decides whether the treatment has to be done or not. So dentist authority must be tempered with a degree of flexibility, because dentist should be a little bit flexible or compromise in order to meet the needs of the particular patient or situation. Okay, so that flexibility should be with the dentist. Next is the education and training. So you need to educate and train the child the way the way you want. Okay, your importance of oral health, the brushing, all those things you need to educate. Why you need to do that? What is the importance of that? And the parents has to train them. Okay. Now, effect of dentist attire. So from the beginning, we were talking about the white coat, how it affects the child, how it affects the child's behavior. So try to avoid a white coat. You can wear a colored coat. You can see in the picture, a doctor is wearing full cartoon colored coat. So that itself will take the child's fear of dentist. Next is lengthy appointments. Make it as short as possible. So if you're doing a lengthy procedure, okay, if you're doing a lengthy procedure, if you want to do a lengthy procedure, try to make the appointment as short as possible. Okay, then appointment time should be early mornings. Okay, try to avoid the nap time. You don't want the child to sit on the chair and sleep like this, because you won't be able to do the procedure properly. So these three things is under the control of the dentist. That is, the length of the appointment should be short, appointment time should be early, and avoid the procedure during the nap time. Now coming to the non-pharmacological behavior management methods. So what do you mean by behavior management? A behavior management is defined as a dental health team, okay, effectively and efficiently performs the dental treatment, and he instills a positive dental attitude. So that is because after you do a behavior management technique, you are instilling a positive dental attitude. So your non-pharmacological behavior management is under the three headings, mainly of communication. Second is the behavior shaping or behavior modification. And the last one is the behavior management. Okay, so always when you get a question on what do you mean by behavior management, you need to write the entire classification. First is under the communication, second is behavior shaping or behavior modification, and third one is the behavior management. So behavior modification, once it has been, it has been asked several times as a short essay. Desensitization is a short essay. Modeling is a short essay. Contingency management is also a short essay. Okay. Now, first is the communication. So communication means I don't need to explain on communication. So it's a universally based in pediatric dentistry with both cooperative and uncooperative child. So communication, there are three types of communication. Can be a verbal communication, what we talk to the child, and a non-verbal communication where you pat the child, you give a shake hand to the child, you smile onto the child, everything. And next is the combination of both verbal and non-verbal communication. So you can see what to talk to the patient. You can try to call by his nickname, give compliment about the watch he wears. Okay, use animation to explain both about the procedures briefly, that tooth is sleeping, bone in the tooth, all those things which I showed before, I showed a diagram before. Yeah, then keep the patient occupied in your conversation throughout the procedure. So that is about the communication. So next is the behavior shaping. So in behavior shaping, I told you there are three things. That is desensitization or systemic desensitization. Second one is modeling. Third one is contingency management. So coming to the systemic desensitization. So systemic desensitization involves the step-by-step elimination of fear. Okay. So it's an effective method for reducing the maladaptive anxieties, teaches the patient to sustain an appropriate and adaptive responses. So basically what you do is you will do a small fear-free procedure to a fear-causing procedure. So that's a step-by-step you're showing or you're doing things. Okay. So tell, show, do is a similar approach where telling the patient what you're going to do and showing the patient what you're going to do and doing onto the patient what you have done and shown to the patient. So, so ideally it is done on the first visit. I hope you guys know what is the first dental visit, importance of first dental visit. I'm just going to the indications. Okay, indications of systemic desensitization is during the first visits. Subsequent visits when you are introducing a new dental procedure, because first dental procedure you would have shown him, you would have understood the what are the procedures you are going to do, and you would have already done it. So when you are giving a new procedure or when you are doing a newer procedure, again you need to do the same. It can be done for the fearful child, then apprehensive child because of the information received from the parents. So these are the indications of systemic desensitization. So you can see the different ways of desensitization. You can see the child is getting introduced to an X-ray. So you're showing it how you keep it, how you keep the X-ray, and you're taking the photograph of the tooth. Okay. Same way you can see a child, seeing the three-way syringe. Yeah, he is pressing it and seeing all those things are there. So that is like you're introducing new things. So he's seeing, he's finding it, he's trying it, and then you are doing it. So systemic desensitization is explained or has been introduced by Joseph Voll. So these are the different techniques of tell, show, do. You can see that before you do a cavity preparation, he's introducing a micromotor. The child is holding it, child is feeling it, child is doing it. Okay, then you are doing the same procedure what you have explained to the child to him. Okay, and the tell, show, do technique was put forward by Adelson in 1959. Same way in the introduction of LA, he's showing into the cotton that this is how I'm going to prick. Okay, so the same thing you are going to do. Next is the modeling. So modeling is put forward by Albert Bandura in 1969. So the procedure involves, allowing the patient to observe one or more individuals or models to demonstrate a positive behavior in a particular situation. Okay. So next is the contingency management. Contingency management means when you give, it is like an introduction or removal of certain reinforcers so that the child will show a positive, gentle attitude. So, say for example, when the child is showing a desirable behavior, okay, the way you want the child is sitting, so you can give a picture. I mean, you can give a toy, you can give a gift. Okay, so that all comes under the positive reinforcement. So the child will understand that if he or she sits properly for the treatment, okay, or shows a good behavior during the treatment, he'll be rewarded. Okay, so that is meant by positive reinforcement. Now next is the negative reinforcement. So negative reinforcement is one which contingent withdrawal increases the frequency of behavior. Say for example, okay, the child is not listening to you. So you will say that if you don't sit properly, I'll be removing your favorite toy. I'll just take your favorite toy away from you. So because of that, okay, because of the withdrawal of the reinforcer, okay, withdrawal of certain favorite thing, what will happen? The child will start to show a desirable behavior. Okay, it's usually the termination of an aversive stimulus is example that withdrawal of the mother means you're not withdrawing, the child mother is not going out. It's like a selective elimination. You'll say, if you don't sit properly, the mother will go. So and mother will say, yeah, bye, I'm going. So what happens? So the child wants the mother to be in the operatory. So automatically the child will start showing a positive behavior. So these are the, till here, these are the things you do to modify the child's behavior. Okay. So next part, what I'm going to discuss is the behavior management part. Okay. I told you when we were talking about the classification of behavior management, it's all done under 3 headings. One is communication, second is behavior shaping or behavior modification, and the last one is the behavior management. Next is the behavior management. So in behavior management, first one comes is what? Audio analgesia or white analgesia or white noise. Okay. So an audio analgesia or white noise is nothing but, it's a method of reducing pain. So it's a different aspect of distraction, where this is a technique consisting of providing a sound stimulus of such intensity that the patient finds it difficult to attend anything else. You are putting a a song with the headphones, and the patient is doing the procedure. Doctor is doing the procedure. What happens? The patient will not hear anything other than the noise that comes in his headset. So that's called as white noise or audio analgesia. Once it is asked as white noise. White noise was asked as a short note. Next is a biofeedback. So biofeedback involves use of certain instruments to detect certain physiological process associated with fear. Basically, you will keep, pulse oximeter. Okay, so the blood flow. Once you are anxious, automatically your blood flow increases. So accordingly, you will be doing the procedure. So the third one is humor. Humor helps to elevate the mood of the child. You can crack joke when you're doing a procedure, talk to the child, crack joke. So automatically his mood will get elevated. He will be, he'll be distracted from what he's doing or what he is going through. All those things will happen. Next is the coping. So coping is nothing but you will give up impulse, or you will give a stimulus so that the child copes up with the treatment. Okay. Say for example, the child is lying down on the chair. Okay. So you would have seen most of the dentists do. If you have any problem, you just raise your hand. I'll stop. So that's called as coping. You're making the child cope himself to the treatment. So next is the voice control. So what do you mean by voice control? The term itself explains, right? So it's a modification of the intensity and pitch of one's own voice in an attempt to dominate the interaction between the child and the dentist. Imagine child is keeping on crying, or he's not listening to you. What happens? You will raise your voice. If you're not going to sit, like that, your intensity and the pitch of the voice automatically increases. So it reminds the child that dentist is an authoritative figure and he has to be obeyed, or I have to obey him what he says. Okay, so that you mean by that's called as voice control. So when it comes to the description of the voice control is a controlled alteration of the voice, that whether it can be a volume, tone, or pace to influence and direct the patient's behavior. So the parents unfamiliar to this technique may benefit from an explanation prior to its use to prevent misunderstanding, because sometimes the parents get misunderstood that why the dentist is coming and scolding my child. Okay, so you need to inform the parent before when you're doing a voice control. The main objective is to gain the patient's attention and compliance. Okay, then avert negative and avoidance behavior, and establish appropriate adult and child roles. So the main indications is maybe used with any patients, and the contraindications means the patients who are having an hearing impairment, okay, and any special child, you can avoid the voice control. Next is the relaxation. Okay, this is a technique used to reduce the stress and is based on the principle of elimination of anxiety. Then the next is hypnosis. So these are all the different types of behavior management techniques. Okay, so it's an altered state of consciousness characterized by the heightened suggestibility to produce desirable behavior and physiological changes. The next is the impulsion therapy. Impulsion therapy means what? Sudden flooding with a barrage of stimuli which have affected him adversely, and the child have no other choice but to face the stimuli until a negative response disappears. So basically, he has now a child should get a feeling that, okay, fine, I've come here. I don't have any other choice but to, face the thing what I'm going through. Okay, and unless and until if I'm not showing a positive behavior, I'm not going to go out of this place. Okay, that's called as impulsion therapy. So next is the aversive conditioning. Aversive conditioning, again, it's been shown as a short note method. Okay, it's a method of managing an extremely negative behavior. So you can see the child is sitting, 4 or 5 people are holding, but he's not ready to show his mouth, her mouth. So what comes under this? That comes is, first you will do voice control and see the child is not going to sit. Okay, so you will start doing a home, that is hand over mouth exercise. It is introduced by Jordan in 1920. The purpose of home technique is to gain attention of a child so that the situation or the communication can be achieved. So it is indicated in 3 to 6 years of age. Healthy child who can understand but who exhibits defiant and hysterical behavior during the treatment. Hysterical behavior means keeping on crying, showing tantrums. Okay. Then child who can understand simple verbal communication, and child displaying an uncontrollable behavior. So these are the indications of home, hand over mouth exercise. Now coming to the contraindications. Contraindications, the child under 3 years of age, you cannot do home because the intellectual ability of the child is less. The second one is handicapped or immature child. You can see the child who's sitting there. Okay, such children you are not supposed to do home. And physical, mental, and emotionally handicapped children, you are not supposed to do a hand over mouth exercise. Now, last but least is the physical restraints. Physical restraints means, that the last resort of handling an uncooperative or a handicapped child. The restraints are usually needed for children who are hypermotive, stubborn, and defiant. So the physical restraints involves the restriction of movement of the child's head, hands, feet, and body. So you can see all of them will come, hold the child, and do the procedure. So your physical restraints can be of 2 types. That is an active and a passive type. So active type is restraints that is provided by the dentist, staff, or parents without the aid of a restraining device. Means they themselves coming and holding the child. That is an active physical restraint. And passive physical restraint is passive with the aid of a restraining device. Then assistance for immobilization, you can see the parents sitting there and the dentist, the child is lying on the dentist's lap and doing the procedure. That is parent assistance for immobilization. Now, different types of physical restraints, that is for body, it can be pedi wrap, papoose board, sheets, bean bag with straps and towels and tapes. For the extremities, you can use Velcro straps, towels and tapes. Okay. For the head positioned, forearm body support. For mouth, it can be mouth blocks, mouth probes, banded tongue blades, and others. It can be straps, sheets, papoose board, and all those things. So Please, physical restraints, once it has been asked as a short note. Okay, so please, when you are writing about physical, it's a short note, it's a 3-mark question. So please, you can make a column like this and summarize of different types of physical restraints. Okay, so this is a mouth probe. Okay, there are different mouth probes. This is again a one more type of mouth probe. This is again a one more type of mouth probe. Okay, with where you can use a suction in it. This is a Pappos board where, you know, the child has no other go. He has to, she can only, her head is only out and she has to open her mouth and sit. Okay, there are different types of, you will get it in, you know, Pappos board with a head strap. You can get it in different sizes. So this is the immobilization aid for the head positioner. Okay. So this is all about your behavior management. So please read about behavior management, because this is a very important topic for you. Okay. So you need to know about each and every steps of behavior management, and you will be able to get a lot of questions from this topic, psychology and behavior management. The questions, the amount of questions you get is more. Okay, so thank you so much.